TriZetto is a healthcare technology solutions provider, and I'm sitting here with the co-founder, Dan Spirek. Very nice to meet you, Dan.
Thanks for having us today.
Well, is there a specific model that you're working on that really connects payers and providers to provide a more efficient healthcare system?
Yes, very much so. If you look at our industry, really the provider side of the business is very separate from the insurance side of the business. TriZetto is the largest payer of health insurance claims. We pay more doctors than any company in the country. But for the last 10 years, have really been focused within the payer organization. Very recently, we've acquired a new company called Gateway EDI that serves 70,000 physicians. And our model is to connect what's been a disjointed process in real time to fundamentally transform the way that physicians check member eligibility and ultimately are paid for the services they provide.
And how is this a game changer? Why is this so different than what we've been seeing in the past?
Well, if you look at the industry today, the process of checking eligibility, ultimately paying claims, is very much paper-based, very labor-intensive, and takes weeks, if not months. By connecting basically the answer to the questions that are asked in real time, patients will be able to be verified at the time of appointment scheduling and will be able to pay before they ever leave the office, fundamentally changing what's been a time-consuming and error-ridden process into one that's much more like all other retail transactions we know.
And how does this cut costs and make things more efficient?
Yeah, absolutely. The industry spends over $150 billion a year simply to transport information between the care setting and the payment setting. This will deeply reduce those costs, improve cycle time and quality.
And do you see this model being used beyond that into other sort of other applications?
Sure, very much so. I mean, I think the industry has always struggled with adoption. What we've learned over time is you've got to find a way to fit your solutions into the provider workflow. What we know is anything that helps doctors get paid will be used. And so as offices are checking eligibility for members, finding out what the patient owes, or finding out ultimately what they'll be paid, it's the perfect time to deliver, for example, the patient's health record, or a reminder that, for example, they might be on a wellness program that the physician is incented to help with. So we see the payment platform creating ultimately a much more robust care management platform over time.
Do you see the experience for the patient changing dramatically as this gets more fitted into the system? For instance, a patient might receive for one visit several bills from different organizations. How does TriZetto fit into that picture?
Sure, absolutely. I think we're all annoyed when we walk into a doctor's office and have to fill out the clipboard again. This technology really eliminates the need for that repetitive and redundant sharing of information. And yes, certainly, like any other retail transaction, if I can pay when I leave the physician's office, I won't get a paper bill, let alone multiple bills that we're used to.
Yes.
I guess the downside is we have to pay for our services at the time they're consumed.
What sort of investment might organizations going forward be looking at if they want to start applying what TriZetto's model is already doing for others?
Yeah, I think it's a very interesting opportunity because in general, these processes help doctors get paid sooner, and while they spend less money to actually get paid, and at the same rate, connect doctors who provide better information to health plans. Net people will save money as they use these solutions, but actually make more money.
What opportunities does TriZetto see on the horizon now that lots of people are focused on this, trying to cut costs, make things more efficient, provide better care?
We're very excited. I mean, again, the challenge becomes adoption. We're very fortunate to have a large customer base in 20 geographies.
How big?
About 400 payers that represent over 100 million insured Americans. In 20 geographies that represent about 70% of the population, over half the insured folks run on TriZetto technology. We think that's going to help create a tipping point for adoption when half the patients that walk through a door in a provider setting are running on this sort of technology platform.
Well, now you've been in healthcare for quite some time. You helped, as I said, found TriZetto. What did you see was needed in the marketplace when you founded this company?
Well, the vision for the company was to provide technology on a faster, lower cost basis. What we've seen over time, particularly for these solutions, are new needs related to members paying higher deductibles, doctors needing to collect more money. Makes it the right time to apply these technologies to solve new problems.
All right. Dan Spirek, thank you so much for stopping by.
Thank you.
I'm Mabel Jong. You're watching continuing coverage of the World Healthcare Congress in Washington, D.C.